Hello, everyone. My name is Will DeBose. I'm the prevention manager at the New Jersey Coalition to End Domestic Violence. My pronouns are he, him. My background is gray. I'm an African American male with a white colored shirt on today.
And hi, everyone. My name is Ariana Cohen, pronouns she and her. I am New Jersey's Rape Prevention Education Program Specialist, and I am wearing a white shirt, a black sweater. My hair is black with some tones of a little bit of red, and my background is white, but it's coming up a little bit gray. And it's so nice to see everyone.
Hi, everyone. My name is Danielle Scott. I'm New Jersey's Rape Prevention Education Director. My pronouns are her and she, and I'm wearing a orange shirt, and my background is yellow with the icons representing my place of employment. So as I said, I'm the Rape Prevention Education Director here in New Jersey, and our three-prong approach during the previous grant cycle, 2019 to 2024, was to implement a three-prong approach where we created protective environments for LGBTQ populations, created culturally appropriate leadership opportunities for girls, and engaged men and boys in the prevention of sexual violence. And so as part of our state action plan, one of the first things that we did was we wanted to ensure that we were elevating the community voice. And so we hosted statewide community conversations around our three-prong approach. Simultaneously, we also were seeking and assessing across the state and speaking with community partners in regards to who was doing statewide work in engaging men and boys. And so one of the things that we found was that the New Jersey Coalition to End Domestic Violence had created the Men of Courage Network. And so we thought that would be a natural fit for us to engage with them around engaging men and boys across the state. So at a annual conference that NJ-CDV, the New Jersey Coalition to End Domestic Violence, hosts, I was able to engage with Will DeBose. I kind of followed him around for a little bit just to, have conversations with him about the work that they're doing in engaging men across the state. And so this conference was centered around primary prevention with a specific focus on engaging men and boys. So at that point, we knew that this would be a perfect fit. So also as part of this conversation with Will and NJCDV, we also informed them of the community conversations that we were having statewide and some of the feedback, the preliminary feedback that we got, which was that men wanted to be seen as advocates and not as adversaries in the prevention work. They wanted the opportunity to share their own life experiences and their own narratives. And they also, and through these communications, through these conversations, we also found that we needed to focus on men who were residing on the margins of the margins. And so those communities that are often under-resourced and underrepresented and are often called marginalized. And so using that data and publicly available data, we were able to look at the New Jersey Department of Community Affairs Municipal Revitalization Index, which ranks all of the most distressed municipalities using the social determinants of health. And so using that data coupled with our community conversations, our qualitative data, we were able to figure out where specifically and geographically we wanted to focus.
And just to follow up with some of the things that Danielle shared, where she talked about really like what was our vision that we were set out to do. And then going into, okay, we're having and creating the right partnerships within New Jersey, and then also making sure that everything that we did was data driven by once looking at numbers from the MRI, but also going out and talking into the community, with the community, which some folks may say that those are focus groups, so we really did call them community conversations. But we also knew that that wasn't enough because taking on a new initiative in prevention work where you're engaging men and boys wasn't something that was really being done at a large capacity throughout New Jersey. So we knew that building capacity was one of the things that we had to focus on. And we wanted to do this intentionally. So we knew that we didn't have all the skills. So it's always good to bridge partnerships with other folks. So we were able to get national TA providers, which were wonderful at gathering groups of men, getting them engaged, also understanding the language and allowing them to show up as themselves. They didn't have to show up as a public health expert. They didn't have to show up as someone who was in prevention. If they were a mentor, if they were a pastor, and they just really wanted to do something, we gave them a seat at the table through these TA providers. And I think that that's really what started to spearhead this project. And then I'm going to say Will kind of took the lead on making it what it is today. So I am going to pass it along to him.
Thank you so much, Danielle and Ariana. I have the unique privilege of being the boots on the ground portion of this work. It's been an amazing process that we have embarked on for the past 5 years. The community liaisons are 5 men that we've partnered with organically, and they're positioned throughout our state as far north as Newark and as far south as Paulsboro. And these 5 men have been movers and shakers in their communities for a long period of time. We just organically discovered each other through relationship, and we have been able to really learn from each other. A lot of this work is really flipping things around. Systems historically have showed up in communities and said, we know what you need, right? We want to provide you with these resources or this information or these services. And what we found during the listening sessions is that the communities really wanted to inform the work. And so the community liaisons have been that vehicle to do so. And so we have allowed the liaisons to inform us, to teach us, to show us really what community organizing and community engagement look like. So I'm grateful to have had this opportunity to do this. We've seen tremendous growth, tremendous change. We've seen groups sprout up throughout the state. We call them courageous spaces because it's not always safe to speak your truth, but you can definitely be courageous when doing so. And so we've allowed young men and boys to have spaces to be fully transparent, to show up as their authentic selves, and to talk about the traumas and the things that they faced in their lives, but not just using it as a session to dump. It's a session or opportunities to really speak and really get some support around some of the things that maybe they either have experienced or are experiencing in their lives. So this work has really been exciting. It's been inspiring. We feel that it's very innovative, and we hope that the country would adopt some of the practices that we have here in our state, because we're really looking to highlight this work. So with that, I'll say thank you. And goodbye.